As I walk these halls and think about the 150 years of service that we've given to our community and to our patients, it's really humbling. Humbling to think of the level of staff that we've had, the expertise of that staff, the compassion and dedication that staff has shown to our community, as well as our patients and as well as their coworkers. For 150 years, Jacksonville Memorial Hospital has been a cornerstone of our community, providing care, comfort, and hope to generations.
150 years is quite a landmark, and I do remember back in the time when my children were being born, the hospital was basically just the 1953 building. Didn't have all of the services that we have now.
When I think about JMH and their capacity to withstand 150 years of the healthcare system and be a leader in Jacksonville, Illinois, I simply say well done. I look forward to continuing your prowess and your prospects. We look forward to working with you. And, you've done a great job over the years, JMH. You can pat yourself on the back on this one.
I would describe Jacksonville Memorial's legacy as a true community partner. They're a place where you can come and get the health care that you need at any time, 24 hours a day, 7 days a week, no matter what the situation.
So when I think about the impacts of JMH on our community, the first thought that comes to mind is monumental. Where would we be without JMH? If you think about all of the community health benefits that they're a part of through our community health needs assessment, our I plan through IDPH, always looking for ways to partner, always looking for things to provide to the community to improve our health as a community. It's monumental what's offered by the hospital and their benefit to us.
JMH being a pillar of our community, they've provided so much hope and care for our generations of families that have been here. I know I've had 3 children here. This hospital has some very caring doctors, nurses.
What gives me the most pride as CEO is hands down our colleagues. I put the life of my family in their hands, and I would do it again. Their dedication, their compassion to our patients and meeting our mission is just what truly gives us the pride and why we excel in what we do.
In the spring of 2019, April and May, I spent a lot of time in both ICU and in the transitional care unit, TCU. I was stricken about midnight, passed out, and was brought here by ambulance, and with a pretty rare disease called granulomatosis with polyangiitis. It took me a little while to learn how to say that, but I do thank my lucky stars that Dr. Daniel Hallam was on duty that night, and although he didn't know exactly what it was, he literally kept me alive. I think the legacy could be summed up really well by the motto that we used to have, friends caring for friends. That it is such a true statement.
The hospital's special. It is a very integral part of our community, and many lives have been touched in many ways.
So saying that JMH and the health department worked closely during COVID is probably an understatement. For months on end, we worked hand in hand. It started before the first positive case came to our community. There was hours and endless hours of planning together, surveillance, looking for that first case. We set up the first testing facility in the county. That was done as a partnership in the parking lot of the health department with JMH staff. And, walking through that day to day really gave us reassurance to have a partner that was as strong and have the resources as the hospital with us every step of the way.
Healthy Jacksonville has been able to make several connections with individuals within our community to provide services. Working with Healthy Jacksonville has been a real comfort. We kind of both lean on each other. I think that really enhances the working relationship between the hospital and the police department, to be able to know that we are both have that essential open door, if you will, that, you can call, you can contact anytime, and we're going to work together to try to find the best possible solution for the individual in need.
Throughout the years, we have been connected with the hospital in many ways, not only financial support, but community collaborations. Most recently, Summerfest has been a program that we have been a part of the last couple of years. But then we also, as a part of that, we have a food distribution that we do, partnering with Central Illinois Food Bank as well as Dot Foods. And it helps with food insecurities and making sure that we are providing food to those in need in our communities. They're more than just a hospital. They're a lifeline for so many people.
For 150 years, JMH has been a community partner for all the government entities within the city and the county.
When I think back about all the positions that came before me, if they were here, I would just like to thank them for paving the way for the rest of us.
I want to give a big thank you to all the doctors and nurses and staff and volunteers that play a part in the 150 years that JMH has been a part of our community.
I love people, and I love giving back to the community and to Memorial Health. It's been good to me and my family, and I want to do what I can.
Well, I kind of think that Jacksonville needs JMH, and JMH needs the community. It's a very symbiotic relationship.
You know, the partnerships we have in this community are going to set us up for another 150 years. They continue to provide great colleagues, great support, which will allow us to meet our mission.
So having a hospital that stood for 150 years means consistency, stability, and sustainability. If there's one thing that you want to have stability in, it's your healthcare. If we don't have our health, we don't have anything.
For 150 years, Jacksonville Memorial Hospital has been more than a place of care. It has been a cornerstone of our community. Here's to the past, present, and future of Jacksonville Memorial Hospital.